Hi friends, I'm Dr. Vikrant, physiotherapist, working since last 19 years in the profession of a specialization in orthopedics, masters in physiotherapy and sports physiotherapy certification. Along with that, I have done advanced pain management from Australia, and we are dealing regularly all the patients including orthopedics, sports and routine physiotherapy issues. So today we're going to discuss about slip disc problems which anyone can face during exercises at the gym. So I'll be taking the questions on the topic, and I'll try to use my wisdom and my experience to help you out how to avoid it and to put more light on the issue. Okay, so we got a question: what is slip disc and how does slip disc affect the body? All right, it's a good question. So I'll try to explain you a little bit what exactly the disc is. So disc, the nature has given in the body like a shock absorber. So whatever stress the vertebra, means the spine, carries, it tries to dissipate and tries to absorb also, so that we can we can live without pain and without jerk, especially while doing work. So how it affects the body? So when we are putting lots of load on the spine, so what happens, this disc gets compressed and it moves from its place, and then it causes irritation to the structures which are just behind the disc. So this is what exactly happens. Just to help you out to understand this situation, I have a small model here where I will show you. So these are the vertebrae. This is actually the spine model. These are the vertebrae, and in between there are discs. So you can see here what happens. This disc moves out from its place and it starts compressing the structures which are just behind to it, like nerves or the neural structure which comes from the brain. So what happens when we are doing any excessive exercise where there is a pressure, this disc comes out and then it causes the trouble. The symptoms can be a pain which is traveling down to your legs, to the butts, or tingling sensation, and it can be accompanied with excruciating pain. So this is how it affects, and it affects your quality of life. The routine work which you do, you'll not be able to do comfortably, and it gives you pain and discomfort. So this is how it affects your body. I hope I try to give some light on that. Any other question? Yes, next. Let me just see. Right. Okay. How to avoid slip disc problem? I think Nikhil has asked this. So how to avoid it? So the best is you should know the capability of yours. How much is is your particular stamina to do one particular activity. For example, if you are in the gym and you know that usually you do only lighter weights, and suddenly you started putting more weights, and suddenly you started an abrupt activity which is causing a lot of stress on the back, and that causes ultimately the disc to move from its place. So to avoid it, the best would be to know your limitations, like to know how much is okay to you. So most of the problem arises when we have a very unrealistic goals. For example, somebody wants to have a good shape, or abs, or a perfect fit, or 8 packs or 6 packs in a very short span of time. So try to understand, in the past, in the history, you haven't done vigorous workout in the gym, and suddenly you started. So this is how it happens. So anything novel, it can be a jerk, it can be lifting heavy weights, it can be doing a yoga or any specific thing for which you are not accustomed, you will get slip disc problem. Okay, now the next question Ashu has asked about what diet should we take during slip disc problem. So let me be very clear with you. Diet directly doesn't have any very important role, except one thing, that you're not supposed to put on weight. So if you are having a faulty diet where excessive calories intake are there, then you will be ending up putting up more weight, which again going to cause more stress on your disc and the back if you're going to have more belly fat. So in that sense, my suggestion would be you should have a good nutritive diet, less of faulty, like fatty things, so that you should not put on weight. All right. Okay. Did I miss anything? Okay. Any other question? All right. Okay. Whenever I train back or shoulder, my back gets very stiff, but I'm drinking enough water and doing stretching. Okay. So the question is, why the patient or the person is getting stiffness in the back. The reason could be, inappropriate loading of the back, I would suggest. For example, ideally you should be very clear about your goals. For example, like you want a lean, thin abs, or you want to have a stronger back. Okay, so for that there are scientific exercises program. So one should consult their trainer instead of just following any haphazard workouts, right? A good trainer would calculate what is your repetition maximum. Like that's a scientific term which we use, and then accordingly different exercise programs can be designed, keeping the need of the person in mind or the client in mind. So in my view, it would be wise to look into the workout which this person is doing. Is it abrupt, or has he suddenly increased the loads? Has he suddenly increased the repetitions? Is he doing a proper warm-up? Is he doing proper cooling down? All these things are very important. Now, as far as water intake is concerned, yes, it does play a role. But as far as stiffness is concerned, stiffness happens, either you're underdoing the movement or you're overdoing the movements. If it is not optimal, it is not adequate, then you're going to get this issue. So I think this is one thing where you can work up, right? Good question. Okay, The question is, can lifting up heavy weight affects the disc? Okay, very good question, because prime reason to have a disc problem is the capability of the back muscles to absorb that much load or to carry on the specific load if the load goes beyond that level. So yes, heavy lifting or heavy weight lifting definitely will affect the disc. So what is the way out? Way out is to train yourself in a scientific manner. We call it PRE, progressive resisted exercises, where you're gradedly increasing the resistance. So the chances are you will not have the issues like a disc issue if you're doing it more scientific. So that's the solution for the problem. Okay. Next question is, what exercises you recommend for slip disc? Okay, it's a very important question, because doing exercises, specific exercises, may not be helpful in all the cases. For example, no two people are same, and it depends on how much is the extent of the problem, and what exactly, how much disc has been bulged or herniated or sequestered. So it depends on the condition to condition of the patient. But yes, we can start with isometric exercises where you're not doing too much of movement, just optimal movement. So how we check? We look for spinal movements, flexion and extension, and then side flexion, rotation, all the exercise, all the movement we check first, and whichever particular movement is painful, we try to avoid it. So initial level, we always start with isometric exercises. So those are those exercises where you're not moving your spine, but you're using your muscle. So basically you're recruiting the muscle, you are using the muscle, so that it should not go in wasting, because wasting can happen if you're not using the muscle, because of the pain, because of the disability. You have temporary disability because of the pain, excessive pain. So we should do those exercises which should not, in the first phase, which should not aggravate your pain. So that's important, and it depends patient to patient. So there, my suggestion is, you should always follow the advice of your therapist, who will check you, who will assess you, and who will design an exercise program for you. So in general, my thumb rule is, exercises should not be painful, and it should be started into a gradual manner, and slowly we should increase it to the complex level, right? Do we have any other question? Okay, so I will summarize the whole topic. The title of the topic was, slip disc problem while doing exercises in the gym or while exercising in the gym. So the idea is you should know what exactly is a slip disc. Slip disc problem is a problem where we are putting a load on the back which it could not take it. All right. So we got one more question, that is what is the best sleeping position in the slip disc? All right. So as far as sleeping is concerned, many a times patient has a problem in turning. So that is very important. And the thumb rule is one should be in a pain-free position. Okay, so sometimes people have a problem in lying straight. So what we advise them, that you can lie down straight but bend your knees and put a pillow under the knees. So it will basically eases out the lower back and patient can lie down comfortably. In many cases, they are more comfortable lying upside down, means head down position, and that can also be used. So the rule is any position which gives you comfort, you should be in that position. But most of the times, lying straight sometimes is a problem and turning is a problem. So there, one should do gradually all the movements, like just slowly turning up. And if you need some help, you can do in initial phases with somebody and in turning. Otherwise, be in a pain-free position. And if you're lying straight, put a pillow under the knees. That will eases out the tension on the lower back and you will feel comfortable. So that can also be done. In many cases, side turn position is also helpful for the patient. So one can turn to one side, which is pain-free, and then put a pillow under the upper knee. That helps out again to, eases the muscle tension on the lower back. So yes, the position should be according to the comfort of the patient. It can be straight, it can be sideline, it can be upside down also. Yeah, that means tummy down position. So that's it. So, all right, I was just summarizing the topic basically. So I'll try to touch, the key points. So first thing is you should know what exactly is the slip disc. It is, too much loading of the lower back, which ultimately leads to movement of the disc from its position, right? So, all right. Sure. We're going to save that video. Okay, so I was summarizing what exactly is a slip disc problem. Why it happens mostly in doing in the gym exercises. The reason is we are not doing exercises properly. That means what is proper for me may not be proper for somebody else. So one has to be having a very rational goal. It should not be irrational goals like in 15 days or in 3 weeks or in 1 month I have to develop my muscle. So that is called unrealistic goal. So one has to understand the age, your other factors, your physique, how it is, how was the history like in the past, have you done exercises well or not regularly. So suddenly you're putting lots of load on the back. So first thing is you should be very rational about the goals when you are doing exercises or doing gymming. Second thing is warming up is very important. Warming up, you should spend 5 to 10 minutes. And same thing with the cooling down. When you are done with the workouts, you should start going for cooling down. Majorly, people have a problem. They want to finish the things very fast, and they have a limited time. They don't spend time on warming up and cooling down. So that can be one of the reasons which can lead to excessive, loading, and ultimately it can lead to slip disc issue. The other thing is, you should keep an eye on your weight. One should not put on much of weight if you are suffering from the slip disc problem, because again, it may add on a factor. Weight can be one of the factors. As far as the diet is concerned, that's what I told you. So the other important part is consult somebody who is professional, who know this, that what exactly you are suffering from. You can consult a good physiotherapist who will tell you or who will design an exercise program for you according to your need and according to your problem. So sorting out or solving a problem scientifically is the key. And second thing which I want to tell you is, yes, you can avoid slip disc problem even if you've suffered. it will not be a lifelong problem unless and until you are not following the things. So try to listen to your body. Your body tells you many times that yes, it gives you pain when you're doing something, excessive beyond a capability. So try to be more, earful to your body. All right. And if possible, go and consult to a good therapist, good physiotherapist, for sorting out this problem and to have a long-term solution. You have to follow certain do's and don'ts, which a therapist will tell you, okay? And good exercise program, rational exercise program. Keep your goals right. Don't be, too fast in doing certain exercises or to achieve, those goals, right? One has to calm down and then go and be realistic. In the last, yes, it is curable and you can get a complete recovery from the disc problems, and you can save yourself from this problem in the future also by following certain do's and don'ts. So that's the summary, and I'll request if we have any other question, otherwise we can just wind this up. Okay, is surgery only treatment for slip disc? No, not at all. Surgery is the last option for the slip disc problem. So if I'll share, the current data, you'll find that across the world, the first line of treatment is the conservative approach. Conservative approaches means without any surgery or without anything invasive, means an injection or a procedure. So majorly a person can recover from the pain and the symptoms or the disability if they are following a good proper physiotherapy program. Yes, medicine sometimes may be helpful but not for very long term, and ultimately you have to modify your lifestyle, you have to strengthen your muscle, and you have to follow the exercise program. That is very important, because why you had that problem, your muscles were not in a condition to bear the load which you put on them. So it's very important to be very realistic about the loading of your spine. No abrupt exercises which are too heavy to do or too difficult to do, I would say. So one should know the limitations of self and then carry further. As far as surgery part is concerned, in a very less percentage of cases, when everything fails, then surgery should be the option. When the quality of life is so much suffered and the disc is so much giving you trouble, like it has sequestered or it has displaced from its position too much and you are getting a neural symptoms, then we can think about the surgery. But the first line of treatment is always conservative, that is physiotherapy, exercises, and in some cases, yes, some medication also. And just to share with you, even if somebody is going for the surgery, one has to do exercises afterwards also. So it's better to try the first line treatment first, which is a non-surgical part. So surgery should always be the last option. So I think we are done with the questions. Anybody wants to ask anything? Otherwise, we can wind up this wonderful session and all the good participation. It was really, really curious questions to take, and I'm very happy to give you a reply so that one can prevent these problems and one can enlighten a little bit about the issues, and one can save themselves from the slip disc problem. All right. Thank you so much. Thanks everybody to be a part of this session, and I look forward in the future to help people out more of those common problems. We'll keep doing these sessions in the future also. So be in touch with us. Thank you very much from the Physiorevive team and from my side. Thanks.